Hello, I'm Sarah Maines, the Liver Cancers Program Director at Global Liver Institute, and it is a pleasure to welcome you to today's policy briefing. As October begins, I am truly excited to kick off our annual October is for Livers campaign, where we once again focus on raising awareness about liver cancer. Throughout the month, GLI is dedicated to advancing liver health and equity by bringing together diverse communities, expanding global dialogue, and driving action across education, prevention, detection, and survivorship. Today, we are diving into the vital role of policy in shaping the future for liver patients, liver health, and liver cancer. Strong, equitable healthcare policies are key to addressing disparities, improving patient support, and driving better outcomes for all those affected by liver diseases and liver cancer. With that, it is my honor to introduce my esteemed colleagues. Alyssa Davenport, Policy Director at GLI, who oversees advocacy efforts to advance policies that improve the lives of individuals and families affected by liver disease. And Giacomo Donini, Program Director of GLI's Liver Health is Public Health, who has over a decade of experience driving international programs, policy initiatives, and advocacy campaigns across global health and development. Together, both Alyssa and Giacomo bring a wealth of expertise in shaping policies and partnership to advance liver health worldwide. Alyssa, I will now hand it over to you to talk about U.S. policy. Thank you.
Thank you, Sarah. My name is Alyssa Davenport. I'm the GLI Policy Director, and I joined the team in January of 2025. It has been such an honor to work alongside you all and to advocate with and on your behalfs. And so thank you so much for having me today. So the nature of the policies that we work with tend to fall into different buckets, with the policies often overlapping into each other. Given the nature of cancer, a lot of these issues specifically are not cancer specific, but then work to prevent and treat cancer on the front end. So even though there's only a couple of cancer specific policies, all of these tie into cancer health and prevention. But first and foremost, I wanted to talk about our Multi-Cancer Early Detection, Screening, and Coverage Act. So this is an extremely bipartisan bill that modernizes cancer detection by allowing for timely coverage of innovative tests that can detect multiple types of cancer before symptoms developed. This was in last year's end-of-year package that ultimately did not pass, but we brought it back again this year, and we are much more hopeful for its progression. The bill would expand access to multi-cancer early detection tests under Medicare, reduce inconsistencies in diagnoses rates by promoting earlier detection, lower mortality by increasing the likelihood of successful treatments, and enhance existing cancer screening recommendations. So why is this important to patients with liver disease? As we mentioned, the track of liver disease leads to cancer. So being able to address cancer early will provide better outcomes. Liver cancer is the 6th most common but 3rd deadliest cancer in the US, and it is one of the only cancers whose rates has steadily increased since 1980. Localized liver cancer presents a 5-year survival rate of 37.3%, but that drops to 3.5% for when the cancer has had time to metastasize. Yet, unfortunately, over half of liver cancer incidences are detected after it has spread. When it's caught early enough to receive a liver transplant, which is a period that can last up more than 5 years, survival rates jump to more than 70%. So it's essential to get this screening passed so that we can get the diagnoses early, the treatment early, and increase chance of survival. The challenges are that there is a cost associated with passage of this bill, and in this temperature, anything with a cost takes a bit of a double take when going across the finish line. Next, we have GLI-borne issue, the GLI Beyond the Biopsy initiative. So liver health can be evaluated in several ways, and although biopsies tend to be the gold standard, it is not the only option. Legislation is under consideration by U.S. Congress to remove potential barriers to veterans using these tools. Clinical guidelines support use of non-invasive technologies, including imaging, to diagnose fatty liver diseases. However, some payers, including the Department of Veterans Affairs, require a risky biopsy to diagnose MASH in order to access medication treatment. It's important to know that this is inconsistent with TRICARE, which is active duty insurance. After targeted advocacy from our team, both the House and Senate included report language accompanying the Military and Construction Appropriations Bill. I have listed the language here, but I will not be reading it as it is quite long, quite run-on sentence, but I'm happy to send any link with the reports or pause and read them to see the language. Our next major bucket is access to care. We have the Treat and Reduce Obesity Act, which is another piece of bipartisan legislation. This bill would allow for coverage of anti-obesity medications under Medicare's prescription drug benefit, while also improving access to behavioral therapy. There are robust research that shows the link of the chronic disease of obesity to the development of liver disease and liver cancer. So treating and preventing liver disease is directly associated to treating and reducing obesity. So why is this important to patients with liver disease? Better access to healthcare allows for better living for all people, including the vital caregivers that support people living with obesity. All patients, including those with private health insurance, would benefit from this change. This is because private insurers tend to follow in the footsteps of what Medicare and Medicaid cover. So if we can get this covered under Medicare and Medicaid, this is something that would allow for insurers to then cover it themselves. So what are the challenges associated with that? Again, this does have a cost associated with the passage, and there is unfortunately a stigma surrounding the disease of obesity. Next, we have Pharmacy Benefit Manager, or PBM, Transparency Act. So PBMs sort of serve between the middleman and it has become controversial. There's been a large policy push to regulate them more heavily, as some of their actions lead to patients paying higher prices for drugs while increasing profits for PBMs and health insurers. The bill would ban deceptive and unfair pricing schemes, prohibit arbitrary clawbacks of payments made to pharmacies, and would require the PBMs to report to the FTC on how much money they make through spread pricing and pharmacy fees. Essentially, this is increasing transparency for the practice, allowing for patients to see more cost savings on their end, as opposed to increased profits on the PBM side. So why is this important to patients with liver disease? Patients are paying more at the pharmacy counter and not seeing the negotiated savings. The practices are very opaque, and patients don't often know the actual price of the drugs that they're taking. They face limited formularies and burdensome utilization management. And of course, in rural areas, especially, the smaller pharmacies are going out of business. Next, we have our Cure Hepatitis C Act, which is another piece of bipartisan legislation led by Senator Bill Cassidy and Senator Van Hollen. Senator Bill Cassidy is a hepatologist out of Louisiana and is a close friend of GLI. This bill would ensure affordable access to testing, treatment, and cures by implementing a nationwide program. It also reaches vulnerable groups, including people on Medicaid, incarcerated, receiving care from the Indian Health Service, and the uninsured. This strengthens the public health effort to prevent and treat hepatitis C and advances the effort to engage, inform, identify, and treat people with hepatitis C. A cure for hepatitis C has existed for over a decade, but millions of Americans are still affected. While left untreated, infection with hepatitis C leads to liver damage, brain fog, abdominal pain, and internal bleeding, and it is one of the leading causes of liver transplantation. The challenges with this are within the infrastructure. Telehealth. So the 2025 bill extending government appropriations included an extension of telehealth flexibilities until September 30th. GLI supports long-term extension of telehealth flexibilities, and in creating the MAHA Commission, President Trump pointed to his expansion of telehealth in his first administration as a priority. This is so important to those with liver disease, as studies show that access to telehealth can improve outcomes for patients with chronic liver disease and increase their quality of life. Access to care is essential for rural patients, and it allows more frequent communication with patients and family engagement. The challenge, of course, is this additionally has a cost associated. Lastly, I wanted to briefly touch on the Most Favored Nation International Drug Referencing Prices conversation. So the expectation within MFN, or the Most Favored Nation, would be to align drug pricing in U.S. to comparable foreign nations. There are some implications for importing reliance on QALYs, or quality adjusted life years, and similar measures and implications for innovations and formulary placements. Ultimately, GLI is concerned about the impact on the research and innovation and development, namely for patients with rare liver diseases, but we are waiting to see official introduced language before taking action. Our next bucket is transplantation. So this is one of the most exciting bills for me in the Living Donor Protection Act. This legislation encourages living organ donations by removing key barriers. It would prohibit the insurance companies from denying or limiting coverage and from charging higher premiums for organ donors, living organ donors. It amends the Family and Medical Leave Act of 1993 to specifically include living organ donation as a serious health condition. Livers are the second most awaited transplant, with nearly 10,500 people on the waiting list in 2023. 17 people die each day waiting. And as we mentioned before, waiting periods can last over 5 years. This would allow for living donors to donate organs without necessary repercussions or hurdles, which would increase the amount of organs available. What are the challenges? The insurance industry pushback in covering this procedure is our biggest hurdle. Next, we have the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which is a bill that was introduced by Charlotte Woodward, who is a heart transplant patient with Down syndrome. She is pushing this legislation to prohibit discrimination on the basis of disability in cases of organ transplant and provide recourse to individuals who feel they have been discriminated against. So this legislation specifically would prohibit the discrimination against people with disabilities in the organ transplant system by upholding, clarifying, and building upon the rights established in the 1990 ADA, or Americans with Disability Act. This would also prohibit covered entities from determining transplant eligibility, denying an organ transplant, refusing referral to an organ transplant center, refusing to place an individual on a waiting list, or declining insurance coverage for a transplant or related service based solely on the fact that that individual may have a disability. So here is our call to action. So your involvement is invaluable. Patient advocacy is the most impactful way to get your lawmakers to listen and change laws. They care about your opinions, and your constituency means so much to them. So with that, we need your help to continue pushing for these important initiatives. First and foremost, I would love to ask if you could sign up for GLI's monthly policy newsletter. It is the most up-to-date information on what we are doing, where things are going, where things have been, and what we can expect. This is the best way to stay in the loop, and it goes out each month early on, so we have the whole month to prepare. Next, I really would love to ask you to contact your elected officials, specifically asking them to support the Multi-Cancer Early Detection Act. Again, this is bipartisan legislation with so many co-sponsors that this is something that should be pushed through this year. I will send out a pre-made template to be distributed, but please feel free to go off script and make your message personal and tell your own story. By contacting your elected officials, you are able to firsthand tell them how this bill would impact you, your community, and the future of their jurisdiction. So thank you so much for having me on today. I hope this was informative in all that we have going on. These are a few of the highlighted priorities, but of course there are things on the back end as well, including regulatory monitoring and actions. But I would love to pass it on to my colleague, Giacomo Zanini, for the global perspective.
Thank you, Alyssa, for your presentation. So let's jump together into what I do for GLI regarding global health policy. I would like to start with one of the biggest international events that GLI brought together this year in May 2025 for the second year in a row, which is called Together for Better Liver Health, Strengthening Public Health Responses to Metabolic Disease. Basically, this event was a high-level international health policy event that GLI gathered during the World Health Assembly, which is, for the ones who don't know, is the annual gathering of health ministers from all the countries represented at the UN. And they meet once a year to discuss the most urgent global health issues. This year's event was co-hosted by GLI EASL and AASLD, two of the major scientific societies in the liver field. And our objective, in continuity with the ones of previous years, was to foster international collaborations, bring together policymakers, public health experts, clinicians, researchers, and patient advocates to form a robust multi-stakeholder partnership. We really wanted to bring them together to discuss a policy framework that will prioritize liver health within a broader non-communicable disease prevention strategies. Basically, what we want this diverse group of stakeholders to do is to work in strong alignment with GLI for us to have the WHO recognize steatotic liver disease as a core non-communicable disease, together with the ones that are already recognized as such as cardiovascular diseases, diabetes, and obesity. We want them to integrate steatotic liver disease into NCD prevention programs. We want them to support research and data collection, and more importantly, to expand public awareness campaigns. This is something on which GLI is really putting a lot of work into, because as we all know, liver disease, it's in most cases either curable or regressible. The liver is a wonderful organ for that. So the power of awareness and education in this process is really incredible. Here are some of the event highlights. We hosted more than 100 people in person at this event. We had 14 renowned speakers divided in two panels from some of the most influential civil organization society from diverse fields like the World Heart Federation, the International Diabetes Federation, EASL, AASLD, ELPA, and the NCD Alliance. The event was endorsed by more than 20 international medical societies, and we had the honor of hosting on stage 5 different ministers of health from different countries: Egypt, India, Mexico, the Philippines, and Qatar. With all of them, we have been working to push a draft resolution for steatotic liver disease to be included officially in non-communicable diseases. This is a process that cannot be initiated just by a civil society organization, but needs to be initiated by United Nations member states. So the role of GLI is really of feeding the member states and really telling them what is the urgency that we're talking about. Then, and I must admit, we're having a very good, powerful response from all of these member states. The event in Geneva was also the opportunity to release the second edition of the best practices in liver health policy report, which is currently available on GLI website. With that report, what we did was we handpicked some of the most innovative health policies that have been recently applied in different states, and it shows that they're all different. I don't want to spoil it to you, so please go and download it from the GLI website. But it shows how a diverse approach is always possible. So really, what we wanna have here is to different states to be involved in the way they can, in the way their economy allows them, in the way their health system allows them. But we want them to be aware that they need to put liver health in a more central space in their political agenda. Here, we can quickly take a look at the media impact of our event, which was pretty impressive. We had about a little less than 200 million people who have been reached for the pre-event press release, and then a little more than that for the post-event press release, we can see there is a huge response from some countries that will guide us also in the near future to do more work specifically dedicated to those countries. Here are the key themes of our policy report. Why we do that? We do that because there's limited public understanding of liver health. And by saying that, I'm not just referring to the general public, but sadly also to the decision makers. Therefore, we wrote this report in lay language to make sure that no one shies away from reading that. That is easily understandable, and it can be let's call it a springboard for us to start a new conversation with them and to show them that there are many ways that a policymaker can impact the lives of the patients living in the country. Another important theme of the policy report is talking about disparities and underdiagnosis. The silent nature of liver disease shows how education and awareness can really be a game changer in fighting back the disease. Another important point that we want to stress is the link between obesity and liver disease. We see in different awareness campaigns how people are starting to, even if slowly, realize that living with obesity is something that can start a waterfall effect of problems that are globally recognized as metabolic disease. Well, steatotic liver disease is an important part of that. Nonetheless, it's still very much unrecognized at a policy level. So we need to focus more on prevention-driven and science-led approaches. Then we can talk a little bit about the importance of global collaboration on this. If we really want to have an impact on global health policy, we need, and this is what GLI is doing at the moment, a broad coalition of medical societies. This is the only way. We need alignment and healthy collaboration among the different stakeholders, which include also the policymakers, other NGOs from different fields that are all involved in the metabolic disease. We need to foster public-private partnerships to make sure that where the public health system is not funded well enough, privates are able to step in and help out to rebalance the process and give this the importance that needs. So we need really a unified movement to make liver health a public health priority globally. This is why sometimes I joke with some of the people I work with about my work being the one of a liver diplomat, because I really work a lot towards GLI being always collaborative and in a proactive approach to work together with very different stakeholders. So we need alignment at a global level, and that is not always easy, but that is the only way. And I will be happy to make an announcement later in the month of October, because we are really working on something big that I cannot yet disclose, but stay tuned with us. Thank you.
Thank you all for joining today's policy briefing. An extra special thank you to Alyssa Davenport and Giacomo Donini for sharing their expertise on how policy and global collaboration can improve liver health. To learn more about the Global Institute and our work, please visit globalliver.org or explore livercentral.org, our hub for liver cancer research, resources, and advocacy. Once again, thank you to my colleagues and to all of you for your commitment to advancing global liver health. Have a great day.